Welcome back to DP60. Today we have a CPC of a lesion that I'm not quite sure of the diagnosis, and I would love to hear everyone's thoughts. This was on the chest of a solid organ transplant patient, and he had other lesions as well distributed on his arms and trunk that were smaller. This was the largest one. There is scale over this light pink thin plaque, and some of the scale appears to be slightly raised and outlining the lesion in some areas. So the only thing that I could think of clinically was that perhaps this was porokeratosis, and lesions of porokeratosis can sometimes be larger in transplant patients. The other thing I was worried about was that it was a slightly atypical presentation of a skin cancer. So I did a partial biopsy trying to include some of this raised edge, and there was no cornoid lamella seen on the partial biopsy. So this is a partial biopsy, so a caveat is that maybe I didn't catch the cornoid lamella, but there really was no lichenoid inflammation or vacuolar change like we would see in a typical lesion of porokeratosis. Instead, there's slight hyperkeratosis and acanthosis, which I think corresponds with the scale and slight thickening of this thin plaque. Also, there were these subtle pink circles in the stratum corneum, pointed out by these red areas, as well as sort of coilocytic change, although the granular layer isn't quite altered in the way that I generally associate with human papillomavirus type changes. I did do an anti-HPV human papillomavirus antibody stain on this, and these cells are negative. We also tried doing in situ hybridization for human polyomavirus types 6 and 7, and that was also negative. So can you tell me what the diagnosis is? I'm not sure. For now, I call this some kind of benign keratosis, so at least it's not a subtle squamous cell carcinoma in situ or another type of skin cancer, but I'm still puzzling over what the best name for this is. Thanks for listening today.